And it's just going to be a conversation between you and I. There's
Okay.
nothing
Okay, good.
to stress about.
All right.
So if you could just start off by telling me your name or just kind of introducing yourself and like all of the questions that I ask, if you could repeat the question back to me,
Okay. Okay.
that would make sense.
Okay. So my name is Kelle Tillman. I'm the Associate Director here at the Health Center. I'm actually a nurse. I'm an advanced practice nurse, and I'm a clinical nurse specialist. And that's my role here at this Health Center as Associate Director.
How many years have you been doing it? Or how many years experience have you been a nurse? Or just like...
So I've been a nurse for 27 years. I've actually been at TCU and the Health Center for 10 years. So I graduated from TCU a long, long time ago. I worked at Cook Children's for 18 years, and then I came over to TCU for the last 10 years.
Okay, cool. Are you a Texas native?
I am a Texas native. I'm actually Fort Worth native, and I haven't gone very far. Stayed right here.
Wow.
That's right, and TCU alum. That's right.
That's awesome. So when do you think, or how would you describe like the health center, I guess? Would you say it's like pretty busy around this time of year?
It is. Our patient census really stays, as far as how I would describe the health center is, our patient census, we stay busy throughout the school year. We stay busy from when sorority rush starts in August, and we stay busy until the end of May, until graduation in May. As far as our census, we do see an increase in census in the winter months because of flu, respiratory illnesses, those type of things. I always say we operate kind of like a combination of an urgent care center and your primary care provider, because we try to see you same day, which is more like an urgent care center, but then family care provider in that we can follow you up and have you come back in for follow-up and see you, monitor you closely to be able to keep you in class, which is our goal, is to keep you in class.
Awesome. So I guess you kind of touched on it, what would you say the main goals of the health center would be, is just to keep students in class?
The main goal is to keep students healthy, not just do disease prevention, but not just, so also focus on prevention as far as taking care of acute illness and injury. So prevention, we do everything from every student who comes through the health center for any visit is screened for depression and mental health issues, but then we also take care of whatever your immediate need is at that time. So, if it's an illness, if it's an injury, if it's travel health for study abroad, or if it's a women's health, exam or allergy shots, but everyone still has that mental health component, and we still look at what we can do for prevention aspects along with just immediate treatment as well.
Okay. So around when the weather starts getting cold, what do you think are some most common ailments that students come in with? Do you see any trends?
So for the most common ailments that we see here at the health center, we definitely do see trends. Sore throats go throughout the school year, believe it or not. They start with sorority rush, sore throat starts, and that's a common ailment that we see. But even through National College statistics, it's called for the National College Health Statistics, sore throat is the #1 diagnosis that's seen in most health centers. We've had an unusual year this year, I'm sure, as you've seen, because we had mumps on campus this year. We had 12 confirmed cases of mumps. But still, sore throat is the most common. In the winter, we also see the flu-like symptoms. We just, Tarrant County's just really started seeing flu this last week. We saw one last week, and flu B is what we're seeing. You have flu A and flu B, but flu B being the most common. But upper respiratory infections, cough, bronchitis, sore throat would be your most common ailments.
Okay. And is there a correlation in your experience between like physical health during this type of the school year and mental health, with finals going on and November or April being like bigger workloads?
Definitely. Because students get more fatigued. They get, so for commonalities with end of the semesters and illness, students, what we see is they get more fatigued, they get run down, they're not sleeping very well, so their likelihood of getting sick increases because their immunities are lower. We also see students that come in with a lot of vague symptoms at this time of year, like maybe it's persistent headache, or it's persistent backache, or it's fatigue, and really what it is it's an underlying mental health issue or concern going on with a lot of anxiety or stress regarding their academic grades and everything that they're trying to take on and complete at that time. So there's definitely, we always see a correlation. We always see a little bit of a heightened with that at midterm time, And then definitely the last couple weeks of school, lots of increased pressures on students and students trying to complete everything that they have, and it starts taking a toll on their physical health.
Do you think there are any common misconceptions about health behaviors, or just kind of like how students should be treating themselves that might not be the most effective?
Well, so common misconceptions of students. So one of the concerns you always have is the student that thinks that you're totally invincible, and so you can go and perform 23 hours out of a 24-hour day, because that just isn't feasible. I mean, students have to get rest. That's like the number one thing I even always say at orientation. If they say if there's one piece of advice you could give students, what would it be? And I say get some sleep, because sleep, it's amazing. I mean, what the body needs to restore and re-energize from sleep. But misconceptions too is always students, especially with this generation, what's the quick fix? And they want the immediate fix. There's lots of campaigns across America right now with antibiotic stewardship. And so we want to be really careful. We really don't want to give antibiotics needlessly unless the student really needs an antibiotic for that cold or that upper respiratory infection. And the beauty of that here at the health center is that, there's never any charge to see a doctor. And so we can see a student and say, we really don't see indications that you need an antibiotic this time, but let's see you back in 2 days if you're not better, and readdress it at that time. But that would probably be one misconception, is that students think that automatically an antibiotic is going to fix everything. And sometimes, unfortunately, those respiratory viruses or cough, viruses last an average 7 to 10 days. And unfortunately, you just got to ride it out. And so I think sometimes, though, it's really beneficial for the student to come and see us, because maybe they don't know what they can take over the counter and what type of over-the-counter medications are best for them to help them through the symptoms and treat their symptoms. And we can help with that and facilitate that.
Okay. What are some health behaviors that you've noticed maybe over the last couple years or the last couple months that might be concerning, more specifically in terms of on college campuses or TCU's campus? Obviously, we kind of touched on mumps. That was more of
that's
an abnormality, but in terms of like maybe trends that college students might be partaking in that might be hazardous towards their health in the long run, have you noticed anything, any trends or?
So maybe trends nationwide for colleges. I don't know if I can really isolate here necessarily. I mean, a couple things I think we could see. One would be, I think the increase in marijuana use across college campuses. I mean, in some ways, in some schools, you across the nation, it's legalized, and some schools here. I mean, I think students don't realize that the after effects of that can cause increased anxiety. So then they've got a lot of increased anxiety, and then they're coming in and they're just, I think they don't really realize the full effects that can play into them. Same thing with their alcohol use, anxiety and the mental health repercussions it takes with that. As far as others, STIs would be another one, and I think just having awareness. Something we offer that I think really helps in that situation is we offer some asymptomatic testing, so a student doesn't have to see a provider. They can just come in and request testing, and they just go directly to the lab, have testing done, and then if there's any problem or anything needs to be treated, it can be treated. But that just increases the access to care and students to know and be taking care of themselves. So that's huge. Another thing the health center always does is we get through an organization in Fort Worth, we get 1,000 free condoms a month. And so we provide free condoms within the health center. They're in all our public bathrooms, all our patient rooms, and students can take those at all times. But those would be the three things that I see highlight that might be trends that I think, that and just the mentality of go and never rest and never really stop. Never, I always say be kind to yourself. I mean, I think sometimes students just think they're invincible and they just are supposed to take it and keep pressing on, and really you do have to stop and be kind and take care of yourself. And there's nothing wrong with stopping and taking care of yourself.
So what about being on a college campus makes it particularly more challenging for students to stay healthy versus maybe living at home like during high school or living on your own? Is there anything specific? Sure.
So your challenges definitely are your community living. You've got a lot of people in a small amount of space, and probably most students here at TCU didn't live that way before. I mean, you probably had your own bedroom and your own bathroom, and now you're sharing a bedroom, sharing a bathroom, eating in the same common area. Things like that really increase your chances of illness, chance of germ spreading. So I mean, you really just need to be very mindful of use hand sanitizer any opportunity you can, wash your hands, clean your room on occasion, wipe down your door handles, those kind of things. But definitely the communal living, I mean, so many people in a small space, it does increase your chance and risk for illness.
Gotcha. And what are some ways students can kind of improve their health or kind of reduce their stress, both mental and physical health, like during this kind of time of the year?
So I think there's lots of good ways they can. I think we'll see more programming coming out of the Wellness Center, which is down at the Rec Center, and they provide programming to help students kind of de-stress through that. I think educating students and letting them know on the importance of de-stressing is really important to help them through that, and things that they can do to prevent it. But hand sanitizer, good hygiene, hand sanitizer, eating a healthy diet, staying hydrated. Those are all good things that they can do to be proactive in taking care of themselves. Those things work, very advantageously. And then also too, like treating their symptoms. I mean, it's amazing sometimes students, have you taken any Tylenol or Advil for your headache? No, haven't tried any. And we're always happy to help and educate students on things that they can do for over the counter and things to help with that. But really just for students to take a pause and take care of themselves and for what they need to be able to stay healthy mentally and physically.
Okay, sweet. I think that's all I have for you.
Are you sure?
Yeah.
I didn't do very good at repeating your questions. I'm sorry.
No, you're
Just
okay.
start
It's
talking.
fine. Yeah,
Okay.
no, you're great.
Okay. All right.
Awesome.
Does that take care of it?
I think so.
Okay.
Awesome.
Okay. If it's going somewhere other than your teacher, please let me know.
Yeah, I will. For sure. Thank you so much.
I appreciate you reaching out to me. It's the ones that always reach out persist.